But we're going to go ahead and get started. Thank you all for being here. Tim, thank you for taking time out of your day to be with us. And so what I've done is I've organized some slides so that we all have a visual to follow along. And they're mostly slides addressing this new stay home, stay safe order, as well as some frequently asked questions that I've been hearing. And then, of course, some resource slides. Before we get started, first want to thank the industry leaders that have been able to take my calls over the last week and couple weeks. I can't really iterate enough how instrumental the information that you've shared with me have been in influencing the stay home, stay at place and essential business exemption order. It's been really helpful to be able to relay some of that information to the county as they've developed. And as you can imagine, all of this is just, it's all new information. It's all happening. The best analogy I've heard is that we're building the plane as we're flying it. So thank you for your patience. Thank you for your support. I also want to thank the county commissioners and the county staff, especially Tim Love, who is putting in extremely long hours right now to manage and respond to this health crisis. It's certainly not a job that I envy. And I can say to you, Tim, and to the county commissioners that the industry leaders that I've talked to have been feel that the local government is responding appropriately and is, feels good about how the government is responding to this health crisis and to this economic crisis. So thank you for the work that you're doing. I know it's not an easy job. I also wanted to thank you all, the businesses that are here on the call, and whether I've talked to you or not, I just want you to know that we at the Economic Development Coalition is, of course, also the county. Thank you for doing what you're doing to support your employees and to support our community in this really challenging time. So to the extent that if we haven't talked, I know I have a few more calls this week, but if you want to talk more, and it's a really, really helpful way for us to convey the information that the county needs as they respond to this. So without further ado, I think, Tim, are you ready to go? So what I've got here, and I think, Tim, I've given you control. You can test that out if you want, but what I've got here, Tim, is kind of summaries of the stay home, stay safe order. And I'm only really focusing on the part about essential manufacturing. So if you want to go ahead and take over the mic and kind of help introduce this order and give us some more context about, especially about the essential businesses. We should be able to hear you now.
Good. Can you hear me? Great. I can't hear you anymore, April. That's kind of humorous. So I'm glad to walk through this today. What I wanted to start with, though, I'm going a little bit off script here, I apologize, but I wanted to share with you, so how did we get here? How do we end up at a stay home, stay safe? Why now? Why are we taking this approach? And because I think that'll be instrumental. Some of this we don't share with the broad public, but wanted to take an opportunity to share with this group. So, this is a data-driven exercise, and I know at times it may not feel as such on the other side of it, but, we've got a public health team that is watching numbers daily. They're looking at models, in other states and other communities, and they're using that to drive our decisions. And so I want to leave y'all with a few items just to be aware of. So, we have 15 cases in Buncombe County currently. About half of those relate to folks who came here from out of state. So wanted to just share that with you. Of the 15, those are confirmed cases. We don't know how many folks are carriers that may not have symptoms. The estimates right now, which are estimates, are that for every one case, there could be as many as 100 people who have COVID-19. So our 15 could easily be 1,500. just unconfirmed cases. Our understanding of the data is that we believe that 80% of the new spread, the new cases that come up, relate to those unconfirmed cases. So when we put in place this order, it's really to, and you've heard it, it's cliche at this point, but to flatten the curve. And I wanted you to know that there's data that we're actually looking at on that curve. Further, I wanted to let you know that the timing on this is key. This is like from a statistical perspective on the epi curve. This is our window. This 2-week window is where we can really make a big difference, which is why we implemented this stay home, stay safe order. So it's not frivolous, even if it feels as such from a distance, but wanted to share with you kind of that information, that data, and assure you that this is a data-driven process. So with that said, April, I'll get back to script, and we'll go from there. So the Stay Home, Stay Safe order was issued yesterday. You can see how to get to it at the hyperlink. That order speaks specifically, first and foremost, to, folks must stay home unless they are doing an essential function. And those essential functions include going to the grocery store, going to the pharmacy, et cetera. Also to go to an essential business. And so within that guidance, specifically we talk about essential manufacturing here, and you can see that on the screen. So if you're manufacturing a product that is considered essential, or if you're supporting an essential industry, so not on this list is any of you that might be supporting the Department of Defense. That's an example of an industry that would be essential. So wanted to just clarify that. As you can see on the right, any manufacturer that's pivoting operations to support COVID relief in the form of manufacture of PPE, hand sanitizers, disinfectants, whatever it is, also exempt from this order. One thing, though, that I have to be super clear on and really need to stress this, being essential does not mean that you're exempt from social distancing. And I know that many of you have already taken actions within your organizations, but I just have to be crystal clear on this. If you're an essential business, sure, you're able to continue to operate, but you must operate within the social distancing parameters of maintaining clean workspaces, but also maintaining appropriate distance, 6 feet between folks for no longer than 10 minutes. This is how we sort of flatten that curve, so I just wanted to be real clear on that. You could be essential, but you still must adhere to social distancing requirements. If any of you have questions, the best way to disinfect, sanitize, et cetera, your operations, our public health department is available to you as a resource. I've been on other calls where people have had specific questions about, can I use this type of sanitizer? Can I use Windex as an example? And there's actually very explicit answers to that. And so I want to make sure that as you're putting in place these protocols, you're using the right stuff.
Thank you, Tim. And I wanted to go back a couple slides to just reiterate that what's on the screen here is not the extent of the order. As Tim mentioned, there is another section for DoD suppliers. So just be sure that you're reviewing the actual order and the supplemental guidance, because there is a little more information. I just kind of condensed specific to who I thought was going to be on the call, but there are some folks on the call that are DoD suppliers, and so I'm glad that you clarified, Tim. Thank you.
Good deal. So the Stay Home, Stay Safe order, it's our best attempt to put out guidance that doesn't cripple our local economy, but that also looks after our public health. And so we may have missed some things. We're not perfect. We did model this declaration on declarations from other states, namely the state of New York. And we sort of did this in collaboration with other local governments in North Carolina. One difference between our local order and those that were issued in Guilford and Mecklenburg County, ours is a little bit shorter. So we've got a 2-week stay home, stay safe order, whereas those jurisdictions have 3-week windows. We have a slightly different curve, if you will, in terms of number of cases we're experiencing. So we took a slightly more lenient approach, but I just wanted to share that with you. So, with that said, if you feel like you are essential, but you're not clearly identified as essential in the guidance, feel free to email the business@buncombecounty.org email address and provide the information that is listed on the screen. We built this process to kind of mirror what the state process has been like. That way we're not being, we're being duplicative, but at least we're not creating new work for you. And the red is a real key point. If you're clearly articulated as an essential business, please don't send us an email. There's nothing you need to do. If you're an essential business and there's no question about it, for instance, if you're in the construction industry or if you're producing semiconductors, it's clear. The guidance is clear. No need to contact us. You don't need any type of documentation. Your employees do not need a pass in their car because you fear that they're going to get pulled over by the sheriff. None of that is actually going to happen. We do reserve the right to inspect your facilities at any time, as we would in normal situations. So ask that you comply, but no documentation is required to be on your person while traveling, and no documentation needs to be provided to the county if you're an essential business clearly. Only if you are listed as non-essential and have questions.
Great, thank you. Can you speak to what you mentioned there, reserving the right to inspect? One of the, I guess, my understanding is that you're really relying on employee complaints for that kind of a thing. Can you speak to that a little bit? Just, I guess, because I think where it's important is for businesses, I think, to understand that maybe the employees don't need documentation, but they need to be very clear about the protocols.
That's absolutely it. And listen, I know that employee complaints come in good times and bad times. Sometimes they're founded, sometimes they're not. Totally appreciate that. So, as we start receiving complaints, we'll reach out to your business. We're not just going to show up at your doorstep. We'll reach out to you and, ask you questions about it. That'll be our process, but it is a Class 2 misdemeanor as written into the declaration to violate the policy. It is not our intent to be that punitive. I can't stress that enough. We have too much going on as it is to police everyone in the county, and really don't want this to come to punitive measures. So we're really just asking folks, if we want to call it the honor system, to really abide by the guidance, and let's all do this together so we can get out of this and get back to work. So.
Thanks, Tim. And I know this question is answered in the supplemental documentation, but if you could just go ahead and speak to it on the call here. How does this impact employees who live outside of Buncombe County?
Absolutely. And what I'd like to do for this one, I'm just going to read this to you just so I don't miss any words, because this is important. So how does this local order affect people who work outside of Buncombe County? Buncombe County does not have the authority to regulate employment activities outside of Buncombe County. While we encourage everyone to stay home and stay safe, residents of Buncombe County who are employed outside the county may travel to work regardless of the nature of their occupation or whether that would be defined as essential or not under the Buncombe County Declaration. So that's our straight up guidance. It's written in the interpretive guidance that went with the declaration. So just wanted to be clear.
Okay, that's actually good. That speaks to it a little bit differently, that if residents who live in Buncombe County work outside of Buncombe County, they're kind of exempt from this ruling. And then for employees in Buncombe County who live outside of Buncombe County, they're basically covered by this order. They're allowed to travel into Buncombe County for work as long as they're going to a business that is deemed essential.
Absolutely. That is absolutely it. So thank you for that. I answered the inverse of the question.
Yeah, it's good. I hadn't thought of it that way either.
Yes.
Okay. I'm going to go ahead and open it up to questions to the group. Oh, go ahead, Tim.
I have one item we did not touch on, and
Great.
This relates to minimum business operations. And so minimum business operations is an important aspect of the guidance that relates to manufacturers, but also broadly. And so what our guidance says is that if there are certain things that, let's say you're non-essential, if there's certain things at your business that need to happen so that your business doesn't completely go haywire, you know, for instance, if you need somebody to monitor inventory that's perishable, or if you need someone to come run a machine, you know, once a week so that the machine stays in operation. If you're, you know, working with, you know, plants or yeast or something that require someone to tend to them from time to time, that is exempt. The caveat here is minimum business operations, so that doesn't mean your full team gets to come to work. That does mean that you can send a subset, but remember, again, the social distancing requirements still apply.
Great, that's a good clarification. Thank you. Also, I noticed we hadn't really answered, I know it's in the order, but when is the stay home, stay place order in effect?
The order will go into effect Thursday evening, so today at 8 p.m. and is currently scheduled to last through April 9th. And we, at this point, have no knowledge of whether or not that order will be extended. We'll continue to evaluate as we proceed throughout the 2-week period. And as I noted earlier, you know, this is a data-driven exercise, so, you know, we'll continue to monitor our cases, continue to monitor how our cases are spreading, and we'll make a judgment call based on that.
Thank you. I guess speaking to the data-driven, there's a question I've received about if you could speak to the decision to close the public testing sites and what drove that decision. And
Sure.
if you're not, yeah, depending on if that's something you can speak to.
Yeah, I'm glad to, and I know this is a really challenging topic. So the reason we closed our public testing sites was a practical one. We're on the front end of this pandemic locally, and we need to make sure that we're preserving, you know, our public health and law enforcement personnel, limiting their exposure to COVID-19, while also preserving our resources related to PPE. So, you know, the ventilators, the gowns, the gloves, et cetera. There's also discussions at the state level and at the national level about, as we proceed, what is the most appropriate way to combat COVID-19. And one school of thought on that is, you know, to focus on the most at-risk populations, the most vulnerable populations, rather than just broad testing. So that is, those are a few aspects. Those all kind of came together to inform our closure of the drive-through testing. However, I should state, that doesn't mean that you're not eligible to be tested. If you feel that you're displaying symptoms of COVID-19, the guidance for you is first to call or email your primary care physician if you have one. If you don't, call or email your urgent care. Under no circumstances are you recommended to go directly to a hospital or ER. Additionally, we advise that you do not go directly to a doctor's office or urgent care without calling first and being screened. So, you know, that is the guidance. Through that process, your doctor or urgent care will advise you on next steps. If you have trouble there, I can also provide contact information for our communicable disease nurses here at Buncombe County Public Health. but would prefer you do that as your third option.
Thanks, Tim. Clark submitted a question asking if you could speak to manufacturers that are suppliers in the 16 critical infrastructures listed in the declaration.
That's right. So I'm going to read a little bit from the declaration. And so section 9B.3 has a section called Essential Critical Infrastructure. And so I'm going to read this verbatim. Work necessary to the operations and maintenance of the 16 critical infrastructure sectors as identified by CISA, including public works, construction, residential, commercial construction, airport operations, water, sewer, gas, electrical, oil refining, roads and highways, public transportation, solid waste, etc. And I'll sort of stop there. So that's all considered critical infrastructure, which is an exempt and considered to be essential business in this order. And if you are specifically a supplier to one of these 16 critical functions, we would consider you to also be exempt. Again, that exemption does not mean that you're precluded from practicing social distancing. And further, we would encourage you, if at all possible, to take actions to reduce the number of folks working and getting as close as you can to a limited to social distancing, just to be clear.
Great, thank you. Any other, looks like there's another question. Is there a list of community assistance resources, Red Cross, et cetera, and services we could provide to employees who may be in need? And, you know, that's certainly a question that we can answer quickly. Tim, I'll let you go ahead and, if you want to speak to it. I can also say AshevilleChamber.org is kind of being a one-stop shop. We've got the coronavirus resource guide. We've got several links with various resources, kind of depending on what resources are needed. So that's one place that I would suggest going to. But Tim, do you have another suggestion?
Absolutely. There's a few resources I'll speak to. On the BuncombeCounty.org website, we have a list, an article that is titled Community Resources. And that link will take you to the United Way's 211 website. And 211 is who we're recommending, everyone reach out to help navigate any of your needs, whether they be financial or just general questions. And so, on that website, you'll find links to food distribution resources. You'll find utility information, about how folks the local utilities are treating shutoffs. There's links to childcare, what to do about evictions and foreclosures, homelessness, etc. So there's a lot of resources there. Yeah,
thank you. Thank you. For mentioning 201, that's that's basically the place. If you don't remember anything else, just remember 201 and you'll get to the resources you need. Okay, another question. We have family members working for us, a husband and wife, for example. Do these individuals need to maintain 6 feet of distance while at work?
That's a tricky question. That's a tricky question. Our declaration does not regulate in-home familial relations. But, I would say from a practical matter, if we're trying to model appropriate social distancing in the workplace, I think they would want to behave as such in the workplace so that we're not sending mixed signals that some people can social distance but others can't. So that's a tricky question, something we haven't thought about, but I would say in the interest of modeling best behavior that you should practice that at work.
Yeah, I think that's a good answer. All right, I don't have any other questions in the chat, but if you would like to unmute yourself and ask a question, I think now would be the time. We have a few other slides of resources that I'll review, but I think this is a good time to ask Tim and or me additional questions that we haven't addressed. Okay, hearing none, I will assume there are no other questions. So, and if for some reason you thought you were talking and you were muted, just go ahead and put it in the chat and I'll convey it. One more question just came in. Can you comment at all on the forecast for testing availability here in Buncombe? It seems like it's going to be essential coming out on the other end to trying to get everyone tested.
Sure. So, I don't know what the strategy will be from our public health folks on where and how we test. I do think some of the initial concerns about the like testing availability, like whether or not we have the supply to test, I think that has relaxed some. And I know that in particular, the Dogwood Health Trust, they've released some information on how they're supporting that effort. So I guess what I would say is that I don't think there's a shortage of testing. I think we're trying to figure out the best way to test to, one, preserve public health resources, like in terms of persons, as well as our supply of PPE.
Yeah, and from what I understand, having not been tested, I understand it's a pretty invasive test, which is why the health of the healthcare professional is so key, because it requires such a kind of a deep swab. So it causes people to gag or cough, or and so that's I think part of the concern. So I can imagine it's a lot to try to manage how and when to do that. All right, let's see, there's another question here. So statistically speaking, I guess the question is, what level of confirmed cases do you seek to stay under in order for this declaration to be lifted in 2 weeks?
Unfortunately, I don't think we have an answer for that. We're just evaluating the number of cases that come in each day, and in particular, how the cases are spreading. So, there's a big difference between, direct, like if, April had COVID and we can clearly identify that she was the person I came in close contact with. That's a very different case than Tim came in and now has COVID-19, but we have no idea where it came from. And so that's called community spread. And community spread is like our number one fear. We're already kind of seeing some of that. And so that'll really dictate what happens. It's not necessarily the number, it's kind of the how, and that's one of those things that changes every day. So.
Thank you. So I think as soon as we're done with questions for Tim, there's some comments in the chat box about opening it up to Q&A between businesses to share best practices, to share ideas, and I definitely want to be able to do that. So I think let's go ahead and just go through these other slides. I think we've covered that and that. So like I said, make sure you go to the Buncombe County website to read the order and the supplemental documentation. And Asheville Chamber resources, oh goodness. Oh, I clicked on that. Okay, hold on a second. Oh, there, Tim is controlling the screen. Okay, here's the website, thank you. So you can see there's good resources there. And okay, and Asheville Chamber has several pages, but there's a resource guide, and our communications team is doing our best to distill all the information we get and put it in one place. So if you feel like you're getting too much information or you're having overload, I know that's one place that can help you distill it and find your way. If there's a need for business relief, there's several resources here. And like I said, I will send the link to this recording to everyone, and I will also send the slides as well so that you have easy access to the links. But there's several resources, and I'm sure more forthcoming about to provide some business relief in this challenging time. And then I also wanted to mention, for those that are pivoting manufacturing to support and manage the response to COVID, there's some really great resources popping up for textile companies. The Carolina Textile District has created kind of a one-stop application process, and they are basically pivoting all of what they do, and then they're also looking for people who are interested in to help produce PPE. So if you're a textile company, please definitely go to that link, and you'll have to, there's two different sections. One is if you're a healthcare professional looking for PPE, then you can apply to receive some of those resources. Or if you're a manufacturer that wants to help, make sure you click on that link to submit your information. And then similarly for non-textile companies, NC State University is starting to compile those manufacturers, and so it's a similar form at this link where you can submit yourself as being willing to help. And I know there are some, there are some of our local manufacturers who are already talking with various vendors and various individuals to pivot their manufacturing. So that's great, and keep those going. If you haven't also submitted these forms, please do that as well, just so that we're all staying kind of cohesive and streamlined. And then for employees, anyway, if you're hiring, please let us know. We're working with the state to let the state know who's hiring, and we're also working with our local workforce board to coordinate, basically anyone. From what I can hear, it's going to be a little bit challenging still finding people. We have the highest number of people who've applied for unemployment in the history of time. However, 90% of the individuals who are on unemployment right now are not necessarily looking for a new job. This is just a stopgap, and they want to go back to their previous job. So there's a little bit of, we're still trying to figure out how to find people within those thousands that are currently collecting unemployment. But so it may take some time and patience, but certainly let us know if you haven't already, if you are hiring, and we can help to streamline that for you. I think that's my last slide. So are there any other questions for Tim? If you could go ahead and unmute yourself and speak up, that would be great. Otherwise, I think we can let Tim go, unless, Tim, you're welcome to stay, but I think we'll just have some industry discussion, like Clark said, about employee separation, sanitation, attendance policies, best practices, that sort of thing. Okay, I'm gonna assume there are no more questions for Tim. Tim, if you want to stay, feel free. So there was one point that Amy Taylor, who's with Jacob Home Industries. Jacob Home, if you don't know, manufactures non-woven fabrics, and they were asking for some, just to hear from other companies about how you're supporting your employees or on altering your attendance policies. If anyone has I know several of you I've talked to that are doing that, so I would love for you to speak up so that I'm not speaking for you. So don't be shy, unmute yourself, dive in. And Amy, if you want to unmute yourself and
hey, April, Leah from Highland Brewing.
Great, hi Leah.
Hi. I don't know if this will be new to anyone, but we have elected, of course, for anybody who can work at home, they are. And also we are trying to separate people. So not only in social distancing at work, but production staff only in the production areas and hospitality staff only in the hospitality areas as they do projects. since we're obviously not open, they're doing things like painting and deep cleaning, inventory, and we have a whole project spreadsheet that is keeping people at work. And in that case, there will be a little more cross-department exposure, but still with social distancing. And then we're looking at other things like having certain folks maybe even use certain bathrooms so that there's not cross-contamination possible there. But shift work is kind of a natural alleviation, and there's cleaning going on between. So those are some of the practices that we've adopted.
Okay, thank you. Anyone else want to chime in? I know I've had some conversation with some of you who have changed your shift hours to allow for a 30-minute break between the shifts. Anyone on the call that's doing that want to share?
Hi, April. This is Sarah with Bucci. We're actually in the process of considering shift changes, and we've been kind of interviewing all of our team members to see what kind of shift change they'd be into. A couple of the ideas are moving from 5 days a week to 8-hour shifts, to separating our teams and having a team that works Monday, Wednesday, Friday, 12 hours a day, and a team that works Tuesday, Thursday, Saturday. So we would be, basically dividing our staff in half, so the interactions would be reduced pretty significantly. One of the other options is to just slide our shifts apart a little bit more so we can do even deeper cleaning between the shifts, and there's no contact at all between the people. So we're literally in the middle of that. And of course, as you might guess, it's almost divided about 50-50 of what people would prefer. So now we have the fun task of trying to decide how best to manage that. And I think the original question had a little bit more, she was kind of asking how we're helping with attendance policies in general. Something that we're working on is actually giving our team permission to take up to 3 weeks to self-quarantine. It would be unpaid time off, but they would still have their job held for them. So if they feel that level of concern and they are in a financial position where they could do that, we are going to be letting them do that. We've also had all of our office staff work at home as well, like Leah said. And we are also being more lenient with unpaid time off when it comes to just if they feel any type of symptom whatsoever at all, we're asking them to stay home. We're also temp checking in the mornings. So we're being pretty overly cautious with any kind of symptoms of anything. And so because of that, we're not having them use their own unpaid time off, and we're just absorbing that as a company. So those are just a few of the things.
Yeah, thank you. Oh, question for you, Sarah, actually. When they take unpaid leave, are they still covered with health benefits?
Yes.
Okay. I know that's an issue for some companies, but I just got an email from our CFO about our insurance company, who's basically providing health insurance during this time for any COVID-related illness and it doesn't apply. Deductibles and copays and all of that don't apply, which I was kind of, just totally astounded to see. So it may be worth checking with your health insurance companies to see what kind of leniency they're applying on their policies, and see if that can, what you can do with that. Anyone else? I know Mark Pasalt is on the call. Mark, would you be willing to speak to kind of what you're doing with staff that is affected by a reduction in revenue and sales, and kind of how you've addressed keeping them on staff while not working? Can I unmute you if you're muted, or let's see, you're
Okay,
muted.
so
Okay,
is that
there
better
you go.
now? Okay.
Yeah.
Hi, here's Mark from Borg Warner. First, I would like to echo a little bit the shift pattern we have in place for a couple of weeks now. So we really separated all shifts, the first, second, and third shift. There's always at least half an hour in between to really make sure there's no contact between people. And another one we have implemented right now is that usually we have some flex crews. They're moving around in our operations. We don't have that anymore. So people are staying in their little teams, of course, trying to keep the right distance to each other, but no further flex work anymore. So I think this is well received. Of course, we keep cleaning wherever we can. And we have a policy in place from Borg Warner, a regional for US entirely, that we give the opportunity that people can stay home for up to 10 days and they still would get all the benefits. And so we try to, at least from a salaried perspective, to use homework or remote work as much as we can. And within the next days, we will see how the other days or 10 days additional to PTO will apply and how we manage that. But I think for us, it was important to keep our workforce ready as soon as everything gets restarted. Yeah.
Great, thank you, Mark.
Welcome.
Anyone else have any other ideas about attendance policies or what you're doing for sanitation?
This is Selena, and I just want everybody to know that if you do have insurance for your company that is supposed to pay loss of income to your employees, I know that it's supposed to just be for natural disasters such as earthquakes and fires and things like that. But I did get a notice from my insurance agent that they are trying to see if the insurance.
Selena, you're cutting out a little bit.
Oh, sorry. I'm not sure why, but can you hear me now?
That's better. Mm-hmm.
Okay. If the insurance agencies are going to try to help with the burden of paying employees that are not working, and maybe we can capitalize on our insurance policies, so they might change that we can make a claim. So you might want to call your insurance agents if you do have that kind of insurance to see if if you can take advantage of that, if they are going to be passing that or not.
Thank you, Selena. Let's see, it looks like Mark Treffinger, you're unmuted. Did you have something to share? We're not hearing anything. Maybe that's not an indication. Feel free to send me a note in the chat if for some reason you're trying to talk and it's not working. We can't hear you. How about James Bailey? It looks like James is unmuted. Is there something you wanted to share, James? All right. Anyone else?
John Vigeland here from East Fork. Can you hear me?
Yes, thanks, John.
Yeah, I had a follow-up question actually for Sarah over at Bucci, following up on the, I guess I'm curious to hear, just because it's new and I'm trying to wrap my head around interpretation, with the Families First Coronavirus Response Act that has the expansion for employee paid sick leave. I guess it was my understanding that if someone is experiencing COVID symptoms and seeking a diagnosis, that law now requires employers to cover paid sick leave, but also to be eligible for the payroll tax credit to cover it. And for us, we're trying to put in place all the tracking mechanisms to actually see who would be eligible for all this stuff. And that's been a question mark for us, what constitutes someone experiencing symptoms and seeking diagnosis? Like if someone's got a runny nose, or if someone's got a bad fever and is having a hard time breathing. Anyways, yeah. But you were speaking to that, so maybe you could expand on that a little bit.
Hey, John. I would say, frankly, right now we're working on setting that structure up as well. So, currently I would say what I'm looking at is, the top symptoms of fever, tightness in the chest, sore throat, things of that nature. We're asking for specific details when somebody does, communicate not feeling well. And then just having to really give consideration. The interim policy that we made before these new laws came out, we basically gave the team member a paid day off when they had any kind of sick feeling at all.
Gotcha.
So they could stay home and kind of see how it played out for that day.
Mm-hmm.
And then the next day, if they were to stay home, but they weren't sure, it was an unpaid day off, or they could use their own PTO. And then after that, we were going to pay up to 60% of their pay while they tried to get tested, or just let the symptoms play through.
Okay.
So that was kind of what we did before any of this came out. And now we're going to be reworking that interim policy to take all of this into consideration. So we're really not complete with that either.
Gotcha. Okay. Yeah. I'm in the same boat.
Yeah, we're making it up as we all go along.
Yeah. I mean, it was just yesterday I got clear, or I think it's clear guidance on when the actual law goes into effect. I think it's April 1, but I was seeing like different dates on the DOL and like the IRS's website. And so, and yeah, it's tough keeping up with all this stuff.
Yeah, it is.
Thank you both. Anyone else? I also wanted to mention, while there's a little wool here, our VP of Public Policy at the Asheville Chamber, Corey Atkins, he's hosting a video call today to review the recent rush of legislation and present high-level takeaways. So that may help John with some of those questions. I mean, I hope so, but if I don't have the link, but if you email me, I might be able to get the link if you want to join the live call. Otherwise, it is being recorded, of course, and it'll be posted on that resources page that I put in the slides, hopefully by the end of today.
Hey, this is Tom Frost over at Jabil in Arden, formerly Nipro. I had some things we've learned through this process.
Great, thanks, Tom.
I'm the environmental health and safety manager here. Supplies and disinfectants. We did find a good supply of a disinfectant from Cintas. They can install them in your mop closet if you're having trouble finding those. And you can just buy spray bottles, and they have what's called an RR1 hospital grade disinfectant that you can use if you're having trouble finding supplies there for sanitizers. And for hand sanitizers, they all also have wall mounted hand sanitizers, and they still have supply there with cartridges that they can get you. That's a couple of resources. I'm sure everybody's having trouble finding the same stuff. So that's a place I was able to find a resource for those. And it's worked out really well here at the site.
Thanks, Tom. If you have a direct contact for who you've been working with, or at least the web address, could you put that in the chat box to everyone?
Yep, I'll get that right now. I do have a local contact.
Great, thank you. And actually, that reminds me of a question that we received from GE Health, GE Aviation, the local plant here. They have gotten a question from GE Healthcare, who's looking for, and I don't know if anyone's using this, I haven't heard of it yet, but they are looking for 4 touchless thermometers. Honestly, I don't even know what that looks like, but if any of you have access to those, or know where to find them, or you've got extra, the GE Healthcare plant is looking for them for their own employees who are still working, and it would be helpful. I was going to send an email, but figured since we've got a lot of you here, that would be super helpful if you have any leads on that. Looks like Jeff, I'll go ahead and mention, since not everyone can see the chat, Jeff Slossman from National Wiper. He also manufactures non-woven and as you can imagine, his demand is very high right now, producing in response to COVID. He says if anyone needs dry, non-woven wipes to use with your sanitization solution, please reach out. He can assist. They have many different sizes. He was telling me the other day that he's working with U-Haul, for example, and he can make really large non-woven dry products, wipes, that then they use in their own solution to disinfect their products and their trucks and everything. So really great resource there, especially local resource. Thank you, Jeff, for putting your contact information in the chat box. And thank you, Tom, for adding the Cintas sales contact. Very helpful. Anyone else? I'd like to probably get this or do this for at least another few minutes. Probably shut it down at about 1 o'clock, which is in about 5 or 6 minutes. So I'll go ahead and give a few more seconds for anyone else that wants to share best practices or ideas that you've implemented.
John from East Fork here again. This isn't really a best practice, but it's kind of a broader question. I would love to run by the group and see if anything comes up. But I mean, for one of our big struggles has just been thinking through, like, it's what everyone's thinking through here, like, how do you balance the kind of economic risks of reducing operations with the kind of like health risks of congregating people in workplaces. And I'd just be curious to hear from folks if they've come up with kind of decision points or thresholds or logic to apply to the situation of, like, how do we think about how much we stay open. I mean, obviously this, like, shelter in place order, the stay home order is going to kind of clarify that a bit, but because it sounds like a lot of folks have developed these ways to spread out shifts and reduce exposure. But would there be something that would trigger, like, total operation shutdown, and just like how to think about that? It's such a hard problem to wrap your head around. I'd be curious to, like, hear what other business owners have kind of come up with.
Thank you. Anyone have anything to share? Love to hear from you. It's a great question.
Well, I guess I'll give it a shot if nobody else is gonna say anything. This is Sarah with Bucci, and it's something that we think about, daily. And I think for the most part, as an essential business, being in food, and beverage manufacturing, our intention is to stay open. Our team is counting on us for them to have a job, throughout this and out the other side. And if we close down for very long, they won't. So we have to weigh, like I'm sure you guys are weighing, being in business on the other side of this and everybody continuing to have the good work that they have. That, for us requires operating throughout it. So barring reaching some kind of level that was way beyond where we currently are. For now, what we've come to is that, to best serve our community and our team, we have to continue operating. And so we just continue to look at all the ways that we can mitigate. I mean, we have team members willing to shelter in place, out where we are. So we're kind of coming up with a lot of strategies for reducing contact. We have team members willing to take grocery deliveries if we provide that as a company, to not leave their house at all for a while. So we're kind of trying to build multiple different scenarios to make sure, A, we mitigate the spread, between team members and contributing to the problem, but B, still being able to operate kind of no matter what happens around us.
Thank you, Sarah.
Yeah, thank you for that.
Jeff Slossman, could I put you on the spot? I know you you have a very analytical mind and very practical decision maker. I can't hear you yet. I do see that you're unmuted, but you may have another, if your phone may be muted.
Can you hear me now?
Yeah, we can hear you.
Sorry about that. Multitasking here, doing 3 things at once. Well, what were you asking?
So John had a question about, if you have any decision matrix that help you balance staying open versus mitigating risk of staying open, and at what point, how do you make the decision? I mean, in your case, you're an essential business and your demand is through the roof right now, but I know that you've had to think about what would it look like if you had to shut down for some reason. How have you kind of gone through those decisions, and what kind of triggers, how do you elevate those different decision points?
Yeah, we've been very proactive from the beginning, hopefully mitigating the risk of having to shut down. We've shut the building down to all visitors, so no one's allowed in except as essential employees. We met with all the employees. We actually give all employees money to go home, prepare for the pandemic in case they had to shelter in place. We've been proactive with them, asking them not to, go out and put themselves at risk. If anyone has come in contact with anybody that they feel is infected, we've asked them to stay at home. And we've found no protocol to do what happens if one of our employees gets sick. Internally, we've set the policy. If that does happen, we will try to determine, where in the building that employee has been. We will shut down those areas and disinfect before allowing other employees in the area, because we are in a unique situation. We cannot afford to shut down. If we had to disinfect the entire building, I don't even know how we'd go about doing it. This location's 500,000 square feet. So we've said we would try to isolate the areas where those employees have been. Our hope is it's not one of our maintenance people, because they are throughout the entire facility. We've limited our machine operators to just their areas, hopefully reducing the size of an area that may become contaminated. And all we're doing after that is praying and hoping for the best.
Thank you. Actually, Mike Adams, if I could put you on the spot as well. Mike was telling me about that he has some folks on call to fumigate in the event that he may need to disinfect the entire building. And so I don't know kind of what that looks like, and if that's applicable to some of you, but Mike, would you be willing to talk about that?
Sure. Hi, April.
Hi.
It's just our regular cleaning crew, and honestly, I don't know the name of the company, but give me 2 seconds and I'll tell you who it is and put it in the chat window.
Okay. Anyone else have other things? We're about 2 minutes past, so I think we'll go ahead and I'll wait for Mike to put that contact information in the chat window. But thank you all for your time and attention, and for everything that you're doing to keep our community and our workforce safe. And I know this is just an extremely challenging time, so my heart goes out to you all. And if we can do anything to, help with, questions or resources or contacts, please let me know. And Mike, I'll leave this open and for enough time for you to go ahead and put that in the chat window. And otherwise, y'all are free to go. Thank you so much.
Thank you.